Hello, my name is Steve Romenesko, and my healthcare journey begins at birth, as many of ours do. Mine was maybe a little bit more complicated, as I was born 3 months early and spent a lot of times in the neonatal intensive care unit. Just being able to get home was purely a miracle for me, and thanks to the many nurses, doctors, and healthcare professionals that helped along the way, I was able to do that. However, that was just the tip of the iceberg. At age 12, I started experiencing symptoms that led to a diagnosis of primary sclerosing cholangitis, a chronic liver disease causing biliary obstruction, and ulcerative colitis, an irritable bowel disease. I was fortunate enough to live near an amazing transplant center in the University of Wisconsin-Madison, and I had my first liver transplant at age 14. In college, my primary sclerosing cholangitis became recurrent, and I started showing the telltale signs of liver issues once again: jaundice, fatigue, being underweight, etc. I thought I had been through all those problems and that I had conquered them, but here they were back again. My care team stated that this was of no fault of my own, that I was a model patient who understood my condition, cared deeply about my own situation, and did everything I could to take care of myself. Eventually, I was relisted for a liver transplant. At this point, our insurance company stated that it would not cover our surgery, which can cost over $100,000 just for the surgery itself, and that's excluding all of the follow-up visits, the monthly labs that need to be done, the checkups, etc. When asked why my family and I were told that it wasn't going to be covered, we were just told that they purely don't cover second liver transplants. Kidneys, hearts, pancreases, lungs, etc. were okay, but not livers. We pushed but got nowhere, getting the answer that we just don't do this, and it felt as if my right to life was stuck in the hands of a giant and uncaring bureaucracy. Even though I had done everything right, I was going to be resigned to an early death that came slowly through the arduous grind of liver failure, only because I just wasn't able to get a second transplant. We tried our best. We drafted a formal appeal to the insurance company where my family, doctors, and others near me wrote letters of why I deserved this surgery and why it should be covered, that I did a great job taking care of myself, that I was a model citizen, a great student, and beyond. In my late teens, rather than focusing on learning and growing throughout my college experience, I instead centered my life around needing to prove that I was worth the expense to be allowed to keep living. I had to prove in dollars and cents to a giant company as to why my life was worth it. In effect, suddenly my existence had a price tag. Fortunately, my family and I figured out that we were able to jump through a lot of hoops and brave a lot of stress and expense to switch to my mother's insurance rather than my father's insurance. It was a lot of difficulty. It was a lot of headaches. It was a lot of late nights stressing over these things, and we figured it out. We were very lucky and privileged, and I was able to get coverage for my life-saving transplant. I'm happy to say that at 25, I received my second transplant, and I've been doing well since then. I've been able to celebrate birthdays, getting married, obtaining a master's degree, and all of life's pleasures, big and small, thanks to my family, loved ones, and the innumerable amount of superstars that have cared for me on my transplant team, my GI team, and everywhere else in between. I've survived despite the broken system, and I know it's because I'm lucky enough and privileged enough to do so. My story isn't uncommon, but I know it also isn't uncommon for somebody to struggle with this battle and lose, because we have a broken system, and navigating it is extremely difficult, and they don't want you to be able to navigate it. We need change. We need to be able to live easier with less stress and financial burden, purely because some of us have been saddled with medical conditions. I've been taught my whole life to care for others, and regardless of any mitigating circumstances, and it's time we teach the system that as well.